I'll just give you an overview as we start, and the meat of the work is going to be done by Rachel Morris in a minute or two, and I'll introduce her in a few minutes. First of all, though, welcome to everybody that's taken the time out this evening to log in to this health and wellbeing launch event. My name's Nick Stoles. There are some very familiar names that I've seen that just logged in already, so welcome to you all. I am by profession a dentist, and I have been in Norfolk for the past 40 years, and for some of that time I worked as the local dental committee secretary, and so I saw firsthand some of the issues that were facing our colleagues and their staff, and right across Norfolk. And so this project, #WeCareTogether, was born out of three factors in the way that we work. The first thing was that there was an awareness of the fact that there was quite a lot of support for our colleagues in most sectors of the NHS, but there was a gap in primary care support. There's been some significant investment put in to try and address this. We're talking about hundreds of thousands of pounds to try and remedy what is a developing problem. Primary care is inherently stressful, and I'm sure that all of us will have had that experience firsthand. It doesn't matter whether you're running a practice, leading a team, or whether you're one of the workforce, you will find it stressful. And it's been more than ever over the past 2 years. And so that's another factor as to why this initiative has been born. But as well as that, in Norfolk, we have seen a real problem with retention. And that's in part because of the burnout that many of our colleagues have experienced. What they've been actually doing is being so busy looking after their patients that they simply haven't had time to look after themselves. And so some of the figures are stark. 47% of dentists in a survey recently said over the next year that they plan on leaving the NHS because of several factors, one of which was the stress they're under. 40% of GPs have said that they would like to move away from patient-facing care over the next 5 years. And 74% of pharmacists said that they were under significant stress in the work that they were doing. So this #WeCareTogether program has come out of that situation. Primary care has been crying out for that in Norfolk and Waveney. And so what we can tell you tonight is that this program is there to support all members of the team, regardless of whether you're a leader or whether you're one of the workforce in another element of it. It is there for every primary care member of staff. And more important than anything, it's actually free of charge to anybody that wants to access this health and well-being care. There are three elements to this. The #WeCareTogether website is your first touch point if you're looking for some support and care. Together with that, there is another part of the program, which is the Shapes program, which Rachel will introduce in a minute or two. And finally, the third part is the Resilience Team Academy, which again Rachel will introduce during her presentation. So Rachel Morris is a former GP and now provider of these two resources within her the way that she is now working. We're going to hand over to her in a minute or two. There will be a time at the end of this presentation to ask questions and to engage in some dialogue. But if you do want to ask a question during the presentation, she's happy to take questions. I suggest it might be sensible to put your hand up if you want to ask questions during the presentation. But if you wanted to ask a question, we're a bit shy, then pop something in the chat box and we can bring that up. Later. This will be recorded, and so it's the opportunity for you to tell all your friends and those that didn't make it tonight about what the NHS are trying to do to provide support for primary care practitioners and their staff in Norfolk and Waveney. So I'm going to pass over to Rachel and let her continue and unpack what she's got for us and to help us with understanding how we might find new ways of working in primary care and avoiding burnout. So over to you, Rachel.
Thanks so much, Nick, and thank you so much for having me here. It's a real pleasure to be working with you guys on the We Care Together project. So thank you for having me, and well done everyone who's made this webinar live after what I'm sure has been a very long day at work. So make sure you've got a cup of tea, you're nice and relaxed, and you're taking it easy. So as Nick just said, I'm Rachel. I'm a former GP. I worked for a long time at Cambridge University teaching general practice, and then I set up the Doctor as a professional curriculum. So that got me very interested in the behaviour of people in healthcare who are in busy, stressful jobs. I trained as a coach, and I've set up my own organisation doing coaching and training for resilience for people in high stress jobs such as doctors, other healthcare professionals, and I particularly like working with those within primary care. That's where I worked. I also host the You Are Not a Frog podcast, and that looks at life hacks to help people beat burnout and work happier. And so you're very welcome here if you're working in healthcare, particularly primary care across Norfolk and Waveney, and you're currently feeling a bit overwhelmed by the demands. And sometimes it feels a bit like you're using all your strength and mental energy to survive the day job. Maybe you're feeling a bit on edge. Maybe the enjoyment's gone out of work. You're not quite enjoying it as much as you used to, but you know that there's a better option than either leaving or becoming sick because of your job, because of burning out. Now I know that there's definitely a better option than that, so I'm going to share some things. So I'd like to know, how many of you have been worried about at some point in your career about your own level of stress and burnout? And that's more of a rhetorical question, actually. You don't need to necessarily answer that, but I don't think I know another healthcare professional who hasn't at some point been worried about their own levels of stress and burnout. And Nick was sharing some figures from dentistry there. We know that in general practice and in pharmacy and optometry, there are very, very similar figures. In fact, even before COVID, a survey from GPs showed that 94% suffering from mild or severe exhaustion, and I think we can see that across the workforce in primary care, actually. And I think that this was from June last year, and I'm sure this figure has gone up. Many adults in this country say the coronavirus pandemic has affected their well-being, and people report being more stressed and anxious, and we know that. And I think particularly the pandemic has had all the extra workload it's brought for people in primary care. But it's also the decisions that we have to make to keep not just our families safe, but us safe, our colleagues, our patients, the people we work with. And so we're having to make all these different decisions, and a lot of the time we don't even know what the right answer is. And that can lead to very specific pandemic specific burnout. And there's also, if you add on the difficulties recruiting right now, and so we're already working with a tired and stressed workforce, which is diminishing. Therefore, the workload is actually growing rather than getting better. And it's not surprising that many people feel at the moment that they are running on empty. They often haven't got enough left when they get home. And I was working with a GP who told me that at the end of the day, she feels like a husk of a person and has nothing left for her family. And you know what? This is a quote from a report into the wellbeing of doctors. I think it applies to wellbeing of healthcare professionals across the board. We do a tough job, but we make it far harder than it should be by neglecting the simple basics in caring for our wellbeing, in caring for our colleagues' wellbeing. And I don't think it's right that for professionals working in healthcare should have to make a choice between thriving in work and thriving in life. And that's what a lot of my work is about. And so I thought we'd just start off with thinking a little bit about stress and how it manifests and why our performance goes down and what happens. Okay, so many of you have seen this stress curve before. It's called the performance pressure curve, otherwise known as the Yerkes-Dodson curve, and it basically shows that under increasing pressure, humans actually start to perform quite well. So I know that I need a few deadlines to get anything done. But after a while, you reach the peak of your performance. In an ideal world, your performance would keep going up and up, but it doesn't. What happens is you start to go down the other side, your performance starts to dip, and you start to slip down the curve. And so I think you can see 4 distinct areas of this curve. Firstly, not quite enough pressure to perform. The second one, you're at peak performance up the top there. The third one is the pressure's just a little bit too much. And fourth, you're not performing well and you may be becoming ill. I'd love to know from those of you watching this webinar in the chat, can you just put a number for where you think many of your colleagues are right now? So just put in the chat, do you think they're in area 1, 2, 3, or 4? And while you do that, by the way, if you're a manager or a leader, you're leading a team, and you'd like to start off a conversation with your team just to find out how they're doing, and you don't want to go in and go, by the way, are you stressed? Are you stressed? Bit confronting. You might want to actually draw this curve and ask them to put themselves on the curve. Where do they think they are? If they put themselves at 2, brilliant, no problem. But if they're putting themselves 3, maybe towards 4, maybe there's a problem, you can say to them, okay, what could happen to get you back to peak performance? What factors are causing you to slip down the curve, and what can we all do about that? So interesting, gosh. Yeah, so we've got 3s and 4s. Tony's saying 4s for just about everybody in pharmacy. It's really, really pressurised out there. And I think many people are feeling that they're running as fast as they can doing the day job, only just have to get home, put the kids to bed, come back, do it all again. Okay, but what I talk about in the podcast, and this is the theme, is that actually we do have a choice. Even though it seems that we don't, there are small things that we can do, and those small things will add up to big things and make a huge difference in the way you work. Now, when I did a bit of a career change, I trained to be an executive coach. I started off with a health coaching course, which I found absolutely brilliant. There were some principles and tools which I learned, which I wish I had known 20 years ago when I was a junior doctor, and it would help me immensely throughout my career as a GP. And when I started doing training for wellbeing and productivity and resilience, I just found that there were these principles that I returned to again and again and again. And I've put them together to form the Shapes toolkit, because they are very helpful for me when I feel stuck, in being able to find a tool to be able to get myself unstuck. And so what I'm going to do this evening briefly is just share some of these tools with you, give you a very brief overview of some of them, and then talk to you about how we can help you through the We Care Together project. Come and learn a bit more about how you can use these tools individually, but also with your teams to try and work happier and beat burnout. Now, the first one that I talk about all the time, which I think is just absolutely fundamental for me, is the zone of power. Now, this is all about control, what we have control of, what we don't have control of. So just want you to think very quickly that this slide represents the whole of your life. And this circle in the middle is the bit of your life you have control over. So do start putting in the chat, what sorts of things in your life do you have absolutely no control over? I'd love to see. What sorts of things you have no control over in your life? Start to stick them in the chat. I'll give you a starters for 10. The weather, no control over that. The traffic, no control. No control over how many pharmacists move into my area and want to work here. I have no control over what's happening in my colleagues' lives in terms of their health and well-being. So just start putting in the chat, what sorts of things do you have no control over? I don't have any control over what my children eat for breakfast. I don't have any control over what you think of me right now. I do have control over how I present myself, though. So I don't have any control over patient demand, over patient expectations, about what's written in the media about primary care right now. So all that stuff is stuff that's outside our control. Then we start to think about actually what's in our control. Now, this is our zone of power. So the sorts of things that are in my control are how I look after myself when I choose to go to bed, how much exercise I choose to do, what I choose to eat. I'm in control of the sorts of conversations that I have. I am in control. Now, this might be a bit controversial. I am in control of when I leave work. Okay, it might not feel like that, but I am in control of that. Now, there might be some consequences of leaving early that I don't want to have, like if me leaving early is going to mean I don't get to those test results and it causes harm to a patient, I will choose not to do that. I will always put patient safety first. But I am in control of when I choose to do my work, when I choose to do the extra, if there is extra, and how I organise my time. I'm also in control of how I respond to situations. I might not be in control of my immediate reaction, but I am in control of what I then do about it. Now, those of you who have colleagues that are pretty stressed out, often what they're focusing on is stuff that's completely outside their control, what they can't do anything about. And that does make you quite stressed, because actually, if stuff's outside your control, there's nothing you can do but get very worried and anxious about it. Now, people that are a little bit more powerful and productive are the people who remain in their zone of power and think to themselves, actually, what is it that I have control over? Now, what I would suggest is that if you feel you're stuck in any way with any situation, then you do a zone of power. So quite simply, get a piece of paper, draw a circle in the middle, and outside the circle, write everything that you feel you're not in control of. And inside the circle, write down what is in your power. And then when you've done that, you can ask yourself, actually, what else could I do? And you might find that there are some options that you haven't yet done yet that maybe take a little bit of courage and a bit of bravery, like have that difficult conversation with someone, or maybe give some feedback to that person about their behaviour. That takes courage. The stuff outside the circle, you just have to accept. So this is very powerful for getting you unstuck. And if you're a leader or a manager, we can provide conversation canvases about the zone of power that you can use with your teams to help them get unstuck as well. So that is the zone of power, and that sort of goes through everything that I do. So I'm going to talk very quickly about 4 main areas where you can take control of. So first one is your well-being. And we know that when the workload builds up and up and up, in primary care, our natural response is just to work harder and harder and harder and harder. And what happens is we end up giving up those things that are really, really important to us, that actually keep us fit and well. So I know that when the workload builds up, often what happens is I start going to my exercise classes. I stop seeing my friends for coffee. I stop spending time with my family, and I find that I'm then waking up really early with all the work going through my mind and not being able to sleep properly and getting grouchier and soon realizing I'm going down the vortex of busyness. So what I'd like everybody to do now is, on a piece of paper, write down one thing that re-energizes you, that you stop doing when the workload gets too high. So write down one thing that you know is really important for your own physical or mental well-being, that you stop doing when the workload builds up and up and up. It might be yoga class, it might be meeting up with that friend for a drink, it might be speaking to your mum, who knows, okay. And then I'd like you to rate it between 1 and 3. 1 being that's not very important, 2 being pretty important, 3 being vitally important, okay. And I bet that most of you have written something down and rated that as pretty important or vitally important. So if you do nothing else, but after this webinar, then this is write that thing down and go and do it in the next week, because often we forget the basics of well-being, the basics of keeping yourself fit and healthy. Because if we want to reverse the cycle of the vortex of busyness, we need to look at the ways to well-being. We need to make sure we're connecting, which is so powerful. We need to make sure that we're active, we're sleeping well, we're setting boundaries. And these are all 8 ways to well-being that we use in the Shapes toolkit and that we teach as ways to keep ourselves fit and healthy. And if you can only remember to do a couple of things, then I would suggest go with ABC. Make sure you're active, make sure you're taking breaks, and make sure you are connecting with people who re-energize you. So, so important. Next, take control of your time. And I don't know if anyone has ever felt like this GP who I was interviewing in 2018. I'd sit there in consultations thinking, I can't get my head around the amount of pressure here. Often we have too much to do, and too little time to do it. So one of the shapes we use that can help with this is the prioritization grid. And what that helps us do, it's a simple, urgent, important matrix. It helps us categorize tasks into those things that are urgent and important, that are shouting out for our attention. And of course, those are the things that we have to do now. Those are like the urgent patient requests and often quite a lot of the clinical work. But there's quite a lot of stuff that's not important, that seems to be urgent, maybe reports for other people, or stuff that's a bit of a distraction that's not urgent and not important. And then what happens is that we have stuff that is really important, like staff development, team development, having lunch with colleagues, that's important but just gets chucked into that not urgent box. And so often the urgent can crowd out the important. And there are things that you can do to make sure that that is not happening. And what we do teach in the Shapes programme is not how to fit more and more into your already really, really busy day. We talk about how you can eliminate things, how you can do fewer things but better, how you can delegate more, how you can automate, how you need to focus more on what you're doing and try and get rid of those distractions that are just stealing time for you. And so we go through a lot of these different things using the urgent important matrix. And just a quick book that I recommend to everybody, and I really wish I bought shares in this book actually, is Essentialism by Greg McKeown. And if you want to go and read up more after this webinar, I'd really recommend that you read this. Again, strapline, the disciplined pursuit of less. You will be more productive, you will be happier. So Essentialism talks about these three truths: doing things, choosing what you say yes to, because anything you say yes to means that you're automatically saying no to something else. There's only a few things that really, really matter. And you know, those of you working in primary care, incredibly capable. You can do anything. You cannot do everything. So you do need to make some fairly hard choices. Next, we also talk about how you can take control of your stress. Now, I have a friend, she's a mindfulness teacher, and she always says to me, Rachel, you need to be more gazelle. Be more gazelle? What on earth do you mean by that? But when a gazelle is eating grass and a lion comes along, what happens? Gazelle runs off. Okay? And then when the lion's gone, gazelle goes back to eating grass. Marvellous, okay? If I was that gazelle, I'd be saying, oh my gosh, did you see the lion? And did you see its hair and its mane? And oh my goodness, what if it comes back later? And I'm never going to sleep tonight because I've got that presentation to do tomorrow. And what's going to happen? And it might come back and eat my babies. And I'm constantly pre-living stuff that hasn't even happened. And there's a quote from Mark Twain. I love this quote. I'm an old man. I have known many troubles, but most of them didn't happen. So a lot of the stress and anxiety we feel is due to the stories we're telling ourselves in our heads about stuff that hasn't even happened. And yes, it might happen, but it also might not. And when we tell ourselves those stories and we pre-live stuff that hasn't even happened, what happens is we go into our stress zones. I call this being in the corner, in our fight, flight or freeze zones. And when we're there, we don't respond very well. We actually end up making quite bad decisions. We find it very difficult to think creatively, to think outside the box. And I'm sure you can think back to times in your life where you made wrong decisions, or you were maybe a bit snappy or shouty, or did something you regret at work. Often it's because you were so stressed, you were backed into the corner and you couldn't think straight. We talk about the neuroscience of this, about the fact that in an ideal world, you'd have a trigger, you'd be able to think about what happened, like someone's rude to you, and you think about, okay, well, maybe they were scared and anxious, and then you would be able to choose your response. However, in the real world, what's happening is that actually something happens, like somebody's rude, and we go straight to our reaction without having the time to interpret what's going on. That's because your amygdala that's causing this reaction is part of your ancient emotional limbic system. It reacts 5 times faster than your rational human thinking brain. And for those of you that have read the marvellous book, The Chimp Paradox by Professor Steve Peters, he calls this reaction your inner chimp. And you can't stop this reaction from happening. It's your brain trying to keep you safe. And let's face it, kept us safe all these years as we've evolved. And You don't really want to be looking at a bus coming towards you thinking, oh, what should I do about this? Should I consider if I step out of the way? This immediate reaction is actually quite helpful, but it's not helpful when you're responding to a difficult email or maybe a potential conflict situation. So we take this and we think about firstly how we put a slither of space and time so we can think about what's happening. We then think about the stories that we're telling ourselves in our head. So if we have a patient that's being incredibly demanding and rude on the phone and is very upset, rather than responding in the same way, we can maybe think, and because we're telling ourselves that we're not being good enough for them, that maybe we've let them down somewhere, or it's really inappropriate that they're being like that. We maybe think to ourselves, we take a minute and we think, maybe that patient is unwell and not thinking straight themselves. Maybe they've just read a very detrimental article in the media. Maybe they're genuinely very ill and they're very worried about what's going to happen to them. Then we can respond in the kind and the compassionate way in which we want to. And we can choose our response by asking actually what is really true. And so in the workshops we do, we're going to think a lot more about how to do that. And one of the things that I do need to say, and this run through the whole of our work, is to say that getting help is really, really important. If you are struggling in ways with this, then you do need to seek professional help. If you feel that you are becoming unwell with stress or burnout, then please go and see your own GP or access any of the help agencies that are going to be up there on the We Care Together website. So that is one thing. Often we tell ourselves we shouldn't ask for help. The stories in our head are that, you know, it might make us, I don't know, that there's other people that need more help than us, etc., etc. But I can't stress it strongly enough. Getting help is really, really important. So finally, and I'm going to finish in a second because I know we want time for some questions from everybody. We can take control of our work life. Okay. Like I said earlier, this concept that when the workload builds up and up and up, the only thing we can do is work harder and harder, that is a surefire way to burn out. But it's been drilled into us, hasn't it, since we did our training, and we think that hard work leads to success, will lead to happiness. This just actually isn't true. As we seen from the Yerkes-Dodson curve, if you're under a lot of pressure, the harder and harder you're working, actually your performance starts to go down. This is actually what's correct. And this is the great news, right? Because happiness leads to productivity, which leads to success. So actually what we should be looking at is how to work happier, not how to work harder, which for me is incredibly good news because it means we enjoy our jobs an awful lot more. And when we talk about happiness, it is not about that touchy-feely floating on a cloud type of happiness. We're talking about meaning and satisfaction and purpose in our lives, which comes from, you know, finding meaning in our work as well. So there are a few ways of working happier, and I'm going to be covering these in another Shapes masterclass all about how to work happier. But firstly, you really need friends at work. Okay, the pandemic has made it very, very difficult, hasn't it, to connect with people at work. Even if you are physically in the building, often you're not allowed to go and socialise so much, and people are locked away in their little rooms. Some people are also even just working from home. And so it has become much, much harder to connect at work. But we know that loneliness brings with it the same health risk factors as smoking 15 cigarettes a day. So it's something we really need to address. And I think we spend so much time at work, you're missing a trick if you don't connect at work with some people. We need to make good choices. There are things that we can do that are in our zone of power for our well-being. So get the basics right. Rest. Make sure you're taking your leave. Make sure you're taking your lunch break. Make sure you're taking breaks in between time. I know people go on and on about well-being, but it is so, so important. And just on that note as well, the other thing I wanted to say is that there has been a little bit of a criticism of resilience and training and stuff, and well-being training, quite rightly saying, well, you're just trying to put a sticking plaster on a system that is really, really struggling. And I just want to acknowledge that 100% changes need to be made in the system. Absolutely. And there are people working above my pay grade to do that. And I am confident that changes will be made. But until then, if we want to keep on working within the system in which we are, we need to make choices for ourselves to enable ourselves to thrive at work. One thing we can do is actually do what you love. So the great thing about primary care is that there are lots of different roles available to us within whichever speciality you're in. And so finding what you're really good at, maybe doing a strength survey or working out those bits of the job that you really love and then doing more of them, can often be really, really helpful in terms of absolutely loving your job. So I think diversifying can often really, really help that. And there are lots of opportunities for diversifying within primary care. You might do some teaching, you might become an appraiser, you might become a clinical governance lead for your practice, or be the CQC lead or the audit lead, or you might, you know, take responsibility for teams, etc., etc. So there's lots and lots of things that you can do. And then finally, I'm bringing it into land now, you need to connect with what makes life worth living. At the beginning of the pandemic, Dr. Adam Fraser released this quote on Twitter, and it just sort of struck me. I thought, crumbs, that's so important, because when the first lockdown happened, I think people were really scared and anxious, but actually some people were working at 100 miles an hour and suddenly life stopped. And he said, what I'm currently observing is that people are fighting for grieving a life that made them freaking miserable in the first place. So during this crisis of the pandemic and then coming out of the pandemic, don't just pivot, but take the time to evolve the way you're living your life in a more meaningful and connected way. Because what I want to do through my work and through the Shapes program is help people feel calmer, make better decisions, and be successful in work and life, because that can only be good, not just for you, but also for your families and for your patients and your clients and the people that you serve as well. So in a minute, I'm going to tell you about some of the resources that we've got going on. But while I do that, I'd love you just to write down one thing out of everything I've mentioned today. I mean, it's been a really, really quick overview that you can do in the next week to help you beat stress and beat burnout. So just write that down. And if anyone's happy to share it in the chat, I'd love to see any actions that you've got. We've just been through just a very few shapes today, that there's many, many more. And I'm pleased to say that we will be providing a lot of stuff through the We Care Together project and through the website in terms of teaching you guys the shapes and helping you use them in practice. We have shapes masterclasses just like this one that anybody can sign up to. We have some live Shapes Toolkit programs. We've got an e-learning course. We've got the Resilient Team Academy and lots of downloadable resources. So we're going to be running 6 Shapes masterclasses, just like this one, on a Monday or a Tuesday or a Wednesday evening. And we've got the dates up on the website. So do sign up for those. Do tell your colleagues about those, because those are really quick and easy way of just sort of listening to a quick overview of some of the shapes. We also have opportunities for you to join the full Shapes Toolkit program training. Now, before COVID, it used to be a day face-to-face. Now it's 2 half days online, and it's a fantastic investment in time for yourselves. We're going to run that in different cohorts, and there will only be 20 places per cohort. So you need to sign up as soon as possible to reserve your place. And the dates will be on the website very, very soon. There'll be one cohort for the reason we're doing it in different cohorts is that people experiencing the same sorts of issues can get together. And you know, it's a really, really interactive course, and we teach you, we go through all these different shapes. And one for the business owners, the partners, one for the sort of senior leaders, another one for practice managers, another one for some of the salaried clinical staff, and then we're running a couple of ones for some of the allied healthcare professionals. So you're very, very welcome to join us there, and we will let you know how to do that. If you'd rather do an e-learning course online, you can join the Beat Stress and Thrive e-learning course, which is 4 e-learning modules. You'll get between 4 and 6 hours of CPD through doing that, and same with the Shapes Toolkit full live training program. So that's the Beat Stress and Thrive course is the e-learning course. You can work through it in your own time, so you can get that. And then finally, yeah, that's it. So those 3 ways of accessing the Shapes program. So the Shapes masterclasses, those the webinars like this. You can come to a full Shapes program. You can come to the Beat, Stress and Thrive webinar. And I've lost my slide about the Resilient Team Academy. Finally, we have the Resilient Team Academy. And the Resilient Team Academy is for leaders and managers in primary care. And that will help you use the Shapes Toolkit with your team. So every month there are webinars that you can dial into. So live webinars, we have, we put you in breakout rooms so you can discuss with colleagues as well. We also have a bite-sized video of a shape plus a team activity. The videos are 3 or 4 minutes long, and there's a team activity you can use in a meeting, which is either 5 minutes, 20 minutes, or 60 minutes long. So you can use that in your team meeting. And we have coaching demos. We have the full Shapes Toolkit program there. And so the Resilient Team Academy is an online membership for any leader or manager. So if you're leading a team or leading people in any sort of way, so if you're an appraiser or you're responsible for anybody, then do join the Resilient Team Academy. Everything arrives in your inbox. There's an online resources area. You can join the live webinars that go every month, and you get monthly resources. So I'd encourage you to look at that and join that as well. So 4 different ways that you can learn the Shapes Toolkit. So I'd like to invite Nick back on, and then we also have Martin Pettifor, who is the project lead for the We Care Together Health and Wellbeing project. And we've got some, if anyone's got any questions about what's going on, we're here to answer them. So hi there. We've got some frequently asked questions anyway that we thought start with. Martin, can I just ask you, is it just for people working in the NHS, or is it for anybody in primary care?
Absolutely anybody who works in primary care, whoever they work for.
Right. So it's not just NHS practice, anybody. It's a primary care across the whole of Norfolk and Waveney. So please do spread the word and let people know. And often we've been asked, how much does it cost? It's totally free to you guys. The usual cost of the Resilient Team Academy is £249 per year. So actually being able to provide this free is an absolutely wonderful opportunity for all the leaders across there, and also with the Beat, Stress and Thrive course and the Shapes Toolkit course. So it represents an awful lot of value. The resources, there's a We Care Together website, Martin. Is that the best way to access all the resources?
I think it's the simplest way. There's a specific URL, which is www.wecaretogether, NW for Norfolk Waveney, /We Care, and that will take you straight to the goodies.
Brilliant, brilliant. So if you've got any questions, so I've just realised that I've scrolled down in the chat and seen lots more things from people. So thank you so much for putting that in the chat, and lots of actions as well. If you have any more questions, one question we're often asked by people is about time, because a lot of people, I think, working in primary care are really, really time poor. So Nick, how have the resources been provided so that they're not going to take up too many people's time, too much time? Because there is quite a lot of stuff out there, isn't there?
There is. I think a lot of the stuff is going to be provided in the evenings. So unless you work late evenings, then there will be the opportunity now. I know some people would prefer to not have to take on something like this in the evening when it's their social time, but actually a little bit of investment in this area from a time perspective may well be a massive reward for you when you've actually dug into it. I've been working a little bit with Rachel's Shapes Toolkit and listened to her podcasts. I Am Not a Frog. And I wish I had been introduced to this 40 years ago, because I could have actually managed my professional career and my professional working life so much differently to the way that it was. I was one of those people in the hamster wheel, running as fast as I could, doing more work than I really should have been doing, and would have benefited hugely from this. Yeah, I think it's going to be in the evenings. You can obviously browse any online information at any time you like. We're trying to try to avoid doing too much of it in the daytime, because let's face it, we're all busy. We're all primary care professionals working in a busy time, and we can't really afford the time to take out a day or half a day that easily. So that's, I think, how we're going to be trying to address this. And I know Rachel's working alongside us with this. So yeah, I think that's the answer to that question.
Yeah. And everything that's coming up is going to be on the Norfolk website, which Ben has just put in the chat there. So that's really good. We've also got everything, all the ways to sign up to the Shapes programme at. You can click through the Norfolk website to get to that as well. So best to go to the We Care Together website. And if you want to find out about what's coming up, if you go to the We Care Together website and you can click through and see the Shapes programme, we'll have all the dates up there as well. So you'll be able to register for that as well. And I think, Martin, is this right? If people sign up to your mailing list, then it'll automatically land in your inbox about what's coming up as well.
That's right, yes. And maybe, Rachel, if I may, just to emphasise, there's a lot more on the website than just the Shapes Toolkit and the Resilience Team Academy, but to save people's time, we've done two things. We've tried to select the best stuff nationally, as well as all the stuff that's available through the different professions. And we've created a fairly simple search tool that allows people effectively say, this is what I'm looking for, and then it spits out the top half a dozen or so resources as based on the feedback we get from people who visit the website.
Great. And you gave me a slide about that as well. There we are. So that's what it looks like. So you can put stuff in the search box there, and then it will tell you, yeah, and then it'll tell you all the resources there, and it will scroll down.
Yeah, and the next slide I think shows yeah, there we go. That's the sort of screen you'll see after that. There's a lot more resources than that available, and they will be visible, but we try and identify the top ones to make life easier for people choosing.
I think it's just fantastic to have everything in one place, because there is a lot out there, but actually it's knowing A, what's any good, and B, what's going to be relevant, and just being able to click through is absolutely fantastic. So if anyone's got any more questions, I've tried to put a feedback link in the chat, and I'm not sure it came out. So I've pasted it several times, and I think maybe Teams is not letting me put links in there. So yeah,
it doesn't seem to have come out.
No, I've put it in several times. So note to self, maybe if I might quickly email Ben actually, and then he can put it in the chat for us. That would be great. So I think if anyone's got any other questions. Handing back over to Nick.
Yes, indeed. Well, if nobody's got any more questions, I think the one thing that I wanted to say is that when you're working in a team together, many of you will see changes in your colleagues, in your staff, that they aren't prepared or they're not comfortable about sharing with you, but the underlying problem is something more profound and more serious. You are very often the people that will be in a position to recognize that. If you start to see that and you feel confident in having a conversation with them, please do point them towards this resource. It's so important that we pick up people who are beginning to drown before they actually get to that point. So I think the message, if you take home anything tonight, is that this resource is out there for those people, for those colleagues, those friends, those members of staff. It doesn't matter what element of work they're doing within your practice, your business. They are entitled to enter this program. Obviously, if it's much more serious than that, then you need to point them in the direction of professional help, as Rachel pointed out. But please do get this message out. It is free. It's available to anybody who's working in your team. So, if you do nothing more, advertise it. There are posters that will be put out there so that you can put those up on in the staff room so that people are aware of it. But I just want to say really thank you to Rachel for presenting in such a coherent and an energetic way. And are you still standing up?
I am standing up actually. Yeah, and Ben very kindly has put the feedback form in the chat. So if anyone would mind filling in the form, that'd be really helpful for us, because then we can change the format of the webinars. You know, we need to get feedback from you guys about what's helpful, what's not. So the link's there. If anyone wouldn't mind clicking that, that would be really helpful. Thank you.
So really, it just remains me to say thank you to Rachel, to Ben, who's organised all of this and coordinated it all, and to you particularly for coming along. I hope you've got something from it. If you still want to make contact with your professional lead, whoever it happens to be, if it's in dentistry, do get in touch with me. But until we meet again over another video, I'd like to say good night to you all. Thank you very much.
Thanks, everyone. I'll put my email address in the chat as well. If anyone wants to and got questions about any of the Shapes Toolkit stuff, then do ask. Do just ask. And please do spread the word amongst your colleagues. I think word of mouth is going to be really, really important. Yeah. And I think we're going to put the recording of this webinar up on the website as well. Is that right, Martin? So it's
yes, it is. Yep.
Good stuff. Thank you.